just to give a quick introduction to what we have tried to do in this collection of essays from about 30 different authors around the globe, and from leading kind of experts on climate and health, the sort of world leaders in the field like Dr. Soumya Swaminathan, Sir Andrew Haynes, Professor Salimul Haq, to emerging thought leaders like my co-editor, Aparna Sen, Disha Mishra, Nishan Shrohi, just to name a few. And I think the argument is that we need to put health at the heart of climate policy. Very often climate policy is seen to be largely energy focused, but as His Excellency stressed this morning, adaptation has to be on an equal footing with mitigation, and within the context of adaptation, the health impacts of climate change are really, really critical. And I think what we try to do with this session is examine not just global climate policy and how it deals with the issue of health, particularly in the wake of the COVID-19 pandemic, but we were also interested in global health governance, which is taking shape, and to see what are the ways in which climate could be integrated into global health governance. And by that I mean, for example, there's an ongoing negotiation on a pandemic, WHO pandemic agreement, also known as the pandemic treaty, but the pandemic treaty does not directly and strongly address issues around climate and environmental health. And those are the sorts of decisions that we have a separate chapter on the pandemic treaty and the ways in which the pandemic treaty could be strengthened from a climate lens is, for example, an idea that we are trying to put forth in that publication. We hear a lot about, increasingly about the One Health approach, which is about planetary and human health linked to each other. But we find that in the pandemic treaty, the environmental dimension of the One Health approach is not adequately addressed. We also find that very often, just like with the SDGs, and when the SDGs were negotiating, one of the things we were saying is you can develop a really large normative and conceptual framework like the One Health approach, but if you don't back it up with finance, it is just putting the burden of surveillance and early warning on developing countries without actually addressing some of the critical issues. Some other recommendations have already been, His Excellency brought them up, but the Loss and Damage Fund is another area where health needs to be brought in. The fund was created in COP27, but no money was put into it. It's an empty bank account. One of our Bangladeshi colleagues, Salimul Haq, was at the forefront of some of the negotiation. He sadly passed away 2 weeks ago, and there are calls now to call the Loss and Damage Fund the Haq Fund, and I think that's fairly appropriate. But health is something that is difficult to put a cost on, and we really do need increased research and data to support the Loss and Damage Fund. And ways in which it could address health. I also want to talk a little bit about the adaptation goal. His Excellency talked about the North Star or the pole star of 1.5 degrees. But there has also been a call from developing countries, particularly small island developing states and countries like with low-lying countries like Bangladesh, to also have a goal on adaptation to kind of correct the inordinate focus on mitigation in global climate policy, and to put adaptation front and center. And the Adaptation Fund is again a strong part of it. So the authors in this volume call for that also. We have in the final section of the report, there's a 10-point action agenda towards the global negotiations, and there are some practical recommendations, and I'm just picking up a few of them. Definitely, the gender and health nexus is really critical, and women are at the face a greater brunt of the health impacts of climate change. I was reading some statistics about what happens to the healthcare of pregnant women during flood events and disasters, but there are many other ways in which the gender dimensions need to be addressed. And again, the normative kind of and the lip service around many of these ideas has been done before, but we have to find ways in which the COP28 can actually, through its ministerial declaration, through its declaration on health and climate change that His Excellency referred to, could actually put forth some more practical suggestions on how to address the nexus of health, gender, and climate change. I think food security, food systems has already been also mentioned, and it came up in the inaugural speech also, and there's a section, we have a chapter and a section on the food systems. There is the Coronivia joint work on agriculture and food systems that needs to be under the UNFCCC, that needs to be strengthened, and particularly there are some decisions on food systems at the COP27 which we have suggested be addressed in specific ways. For example, currently the food system focus is very much on terrestrial agriculture, and what are the ways in which we can take a more systemic view of food systems. I think those are the sorts of recommendations that are there in the report. I urge you to kind of pick up a copy and kind of get back to us, the editors, if you have any thoughts and suggestions. I also want to just close my comments by suggesting that, and I'm a kind of an anthropologist by training. I follow a lot of literature on public perception, and increasingly evidence is suggesting that framing climate change as a health issue is likely to garner greater support and greater public support for climate policy and climate action. Health is something that people can relate to, and I think, again, in the spirit of the conversation this morning, focusing solely on negative outcomes is probably not that productive, but positive communication about the health benefits of climate action and low carbon lifestyles can also include influence potentially change in values and behavior change. So those are just some of the kind of nuggets or ideas that I wanted to share today, and over to the organizers.